Here are the top 10 pitfalls to avoid in the management of trauma patients. 1. Inadequate primary survey. Failing to perform a systematic and thorough primary survey can lead to missed injuries and delayed interventions. Always adhere to the ABCDE approach: airway, breathing, circulation, disability, exposure, during the initial assessment. 2. Overlooking spinal precautions. Neglecting to protect the spine in trauma patients with potential spinal injuries can worsen existing damage. Apply appropriate cervical spine precautions until clearance is obtained. 3. Improper fluid resuscitation. Excessive fluid administration is associated with increased mortality in trauma patients. Early blood transfusion can be beneficial in severe trauma and major bleeding. 4. Neglecting secondary survey. After stabilizing the patient, a thorough secondary survey is necessary to identify hidden injuries that may not have been apparent during the primary survey. 5. Prematurely attributing altered mental status to trauma. Always consider alternative causes of altered mental status, such as hypoglycemia, intoxication, or neurological conditions, rather than solely attributing it to the trauma. 6. Lack of reassessment. Continuously monitor the patient's condition and reassess regularly. Trauma patients can deteriorate rapidly, so vigilant observation is essential. 7. Failure to consider multiple injuries. In polytrauma patients, avoid focusing solely on the most obvious injury and ensure a comprehensive evaluation for multiple injuries in different body regions. 8. Failure to consider the potential for non-accidental trauma. In cases of pediatric trauma or certain vulnerable populations, consider the possibility of non-accidental trauma and follow the appropriate protocols for reporting and investigation. 9. Disregarding psychological support. Trauma patients may experience significant emotional distress. Offer psychological support and consider involving counseling services when necessary. 10. Lack of post-discharge planning. Ensure appropriate follow-up care and arrangements for trauma patients, including rehabilitation, home care, or outpatient visits, to promote optimal recovery and prevent complications. In summary, by being mindful of these pitfalls and adhering to evidence-based practices, trauma doctors can enhance their ability to manage trauma patients effectively and improve patient outcomes.